name's Allison. I will be your student nurse for today. Can I get your name and birthday? Okay, I've verified the patient's name and birthday by looking on their wristband, as well as them telling me. So sir, here today I'm going to be doing your dressing change for your port. So I'm going to clean off my table first. Okay, you got that nice and clean. Okay, and wash my hands once again. And so I'm looking at his dressing. There's a tegaderm, so I can see through it. I'm looking for any redness, any drainage, any swelling that they may be having, asking the patient if there's any pain that they're having. Okay, so while removing the old dressing, it's going to be clean, not sterile, so I'm putting on gloves. Okay, and I'll be peeling away the tegaderm and the biopatch towards the site. And you never want to use the scissors when removing the dressing because you don't want to run the risk of cutting your tubing. That would be a no-go. Okay, so I've got my dressing. If there's anything pourable, poppable, flakeable, drainable, spillable, then you would use a biohazard bag, but it is still clean, so I don't have to. Okay, so I've tossed that. Okay. Alright, so next, I am going to get my supplies. So I've got a PosiFlow, because we're going to be changing out this PosiFlow. And I've got my 10 milliliters flush here. Okay, so I'm going to be taking that off. No, toss it. Okay, so I'm going to be getting any air out of there. Whoa, okay, all right. And then I'm going to be opening up my PosiFlow, and I want to prime my PosiFlow. Okay, all right, we want to leave that in the package here. Okay, so we can get that here. Got some alcohol wipes and a scrub hub. And then we've got our dressing change kit here. So we can get that. Okay, and I've double checked the expiration date and everything, all the contents. Let me get that out. Okay. Got a mask for the patient, and I already have one on, so I'm good to go with that. Okay. Got our gloves. Let me put these off to the side here. Move it here. Okay, so now let's stand back. Okay, all right, so now we're sterile. We can reach over here. We also want to open up our biopatch here. Stand back. I'm going to flick this. Or actually, we don't have to be super crazy because this is sterile already. Oh, okay, I am still within my sterile field, so we're good. Get kind of, there we go, got it back on there. Okay, so now we want to take our chlorhexidine. So we've got our chlorhexidine, crack her open, and for 30 seconds, so watching the clock, with friction, we can do circular, we can do up and down. We want to make sure not to move the port around too much, or the Huber needle around too much. Okay, and then you also want to get the tubing, keep that clean, get that nice and clean in there. Okay, so that's been 30 seconds. Okay, then we can toss that. Okay, all right, so now, okay, all right, we've got that. All right, so now, next what we need to do, we need to remove, let's see here, we need to remove our old PosiFlow. Okay, and take this. Okay, oh, first we want to take our alcohol. Well, we could use our scrub hub. This will actually work a little better, because it's going to get in the tubing. Okay, and we're going to do it for 15 seconds. With friction. Okay. All right, I'll allow that to dry. Connect our flush. I'm going to make sure that clamp is open, which now it is. Okay, first we want to aspirate for a blood return. Okay. Not really getting, oh, there we go, getting a little bit of a blood return. Okay. If you didn't get a blood return, cough, move around a little bit. If you still didn't get anything, then you would contact your healthcare provider, of course, after making sure that your clamp is open. Okay? And then using a push pause, we're going to go ahead and flush the entire 10 milliliters. Okay? Clamp. Disconnect. Alcohol your port off, using friction for another 15 seconds. All right, 15 seconds. We're going to allow that to dry. And if you had a stat lock of some sort, you would use that to secure. Okay, so now we're going to use we're using our BioPatch, glue to the sky. Get that right around the needle there. And then we've got our Tegaderm. So we would open that up, apply that directly over the site. You want to make sure that you're seeing everything so you can easily assess it when you come in and check on your patient. Okay, so that is on. And then after we do that, we want to document what we flushed, how much we flushed, where we flushed, so the site, the time, what was the patient's reaction, if there were any adverse reactions, and that, oh, and the dressing type that we used, and of course the cleansing, and that, and if we used any heparin at all, so the type of, and that is all.